Hi, my name is Dr. Kathy Burns. I'm the medical director of ADAMH. ADAMH is the agency that funds the community mental health centers where you'll be going to receive services. I think you found out a little bit about NetCare, which is the place where people begin to receive services when they need some mental health kind of help. And after an appointment there and an evaluation, you'll be referred to a community mental health center. At the community mental health center, you'll talk again with some social workers who work there, and eventually be referred on to a medical doctor, a psychiatrist like myself. You will talk with the doctor about any problems that you're having, things that you may be feeling. The doctor was going to ask you questions about how you're sleeping, how you're eating, whether you've lost any weight, whether you're able to function at work or at school or with your family.
Some of our clients obviously are not familiar with what trauma actually is. That may be a new word for them. So we often go in and try to explain to them that it's a combination of symptoms that they might be experiencing that are a result of frightening or life-threatening events. Some of those symptoms would be problems with sleeping, problems with their appetite, depression, excitability. They're unable to feel safe in their homes or in their environment. And they might also have some panic and anxiety and general fears about things that they normally would not be afraid of.
On the Day of Judgment, the Islamic text relates that God is going to hold you accountable for everything that you had done with your body, everything that you have done with your soul, everything that you had seen with your eyes, everything that you have heard with your ears, everything that you smelled with your nose, and so forth. It's a divine and godly responsibility, number one, to take care of your body.
waxa weeye waagii hore qofka xarigiyaan doonan jirnay, xarig baanu qaadan jirnay, waanu xirxiri jirnay. muxuu ahaaye marka hore qur-aan baan kula tacaali jirnay, kabacdina traditional healing ama farsamooyinka kale oo dhaqanka ah oo Soomaalidu dhaqankeeda dhaqan daaweedka dhaqanka baanu kula xiriiri jirnay. markii aan ka quusanana takhtar baa la keeni jiray.
This is not Somalia. This is a place many thousands of miles away from Somalia. There are problems that are new to us, that we have never heard of. And so whatever the problem is, whatever the illness is, to seek cure for it and to not see it as some sort of embarrassment is very important, because these are things that God had ordained to be part of the life of the human person. There's nobody, no nation in this world that could stop illnesses from happening to people. You can't do that. But what you can do is seek and cure. Just as the Muslim is obligated to seek knowledge on their faith, on matters of life, on marital matters, on other social aspects, seeking cure for your body is that important.
Most of the time, Somalian community, they don't have that much understanding about the mental health services. So we really do have some problems in regards the medication, especially the injection type of medications. They're sometimes thought if they get this side medication, they might lose their mind or they might become totally lost.
The medications that we use are not supposed to make a person feel drugged or out of it. They're supposed to help you feel back how you were before you started to feel bad. They're supposed to help you feel back to normal. If you're getting too much medicine or your family member is getting too much medicine, you have to let the doctor know that so the dose can be reduced. So we don't want you to feel drugged. We don't want you to feel out of it. We want you to feel as good as you once felt before you came for help.
I really try to understand them. They really need help. And they might need some medication or they might need some community service. So in that way, some of them are really very hard to understand this mental health issue. But we try our best here.